Hyperbaric Oxygen Therapy Center, contributing to the development and implementation of advanced therapeutic modalities within the healthcare sector. In addition, he served as a research advisor at Taylor University, supporting research initiatives and the translation of scientific knowledge into clinical practice, combining expertise in healthcare operations, clinical innovation, and research. Mr. Khuhan continues to play an important role in bridging healthcare delivery with emerging medical technologies. Please welcome Mr. Khuhan Puraviappan.
All right. So good morning, esteemed colleagues, ladies and gentlemen. Welcome to the 8th World Congress on Anti-Aging, Aesthetic, Regenerative Medicine, Nutrition, as well as Exercise Medicine. My name is Khuhan Puraviappan, Head of Clinical Operations at NHF Medicare, and today I am deeply honored to present a therapeutic modality that stands at the very intersection of biotechnology and clinical regeneration, Hyperbaric Oxygen Therapy, or HBOT. In our quest for longevity, we often focus on genomic sequencing, stem cells, and complex biochemical pathways. Today, I want to show how we can use simple, fundamental elements of oxygen combined with environmental pressure to act as a profound epigenetic master key that drives systemic tissue repair and cellular rejuvenation. Right, so let us answer the first question. What is HBOT? The clinical definition of what HBOT is, okay, a lot of people think that HBOT is just about oxygen. But HBOT is more than just oxygen. It's about delivering oxygen in a pressurized environment. So as you can see here, hyperbaric oxygen therapy is a specialized, non-invasive medical treatment designed to dramatically increase systemic oxygen delivery, and it is defined by two primary variables operating in tandem. Firstly, pure oxygen delivery. We supply our patients with 100% pure medical grade oxygen during the entire treatment session. And secondly, atmospheric pressure. Right now, we are in about 1 atmospheric pressure, and inside of a hyperbaric chamber, we are able to increase it to about 1.5 to maximum 2.5 atmospheric pressures. Right, so to understand how this works, we must look at the classical physics of gas solubility, specifically Henry's law, represented by the elegant formula C equals K times P. Under normal environmental conditions, the oxygen we breathe is almost exclusively carried by the hemoglobin in our blood cells. However, hemoglobin has a strict physiological ceiling, even at sea level. It is already nearly fully saturated at 98%. This means breathing extra oxygen at normal pressure adds virtually nothing to our tissues. But when we place a patient inside of a hyperbaric oxygen therapy chamber, pressurized to about 1.5 to 2 atmospheric pressure, Henry's law takes over. The concentration of dissolved oxygen in the liquid is directly proportional to the partial pressure of the gas. By multiplying the environmental pressure, we force oxygen gas to dissolve directly into the blood plasma, into the cerebrospinal fluid, as well as the interstitial fluids, bypassing red blood cells entirely. This achieves a 10-fold to 15-fold increase in dissolved oxygen. And this hyperoxygenated plasma can easily diffuse into ischemic, swollen tissues and narrow capillaries that the red blood cells are physically too large to reach. Right. This massive physical dissolution of oxygen triggers 3 core cellular dynamics. First is hyperoxygenation. By saturating the plasma, we instantly deliver vital oxygen to ischemic tissue beds, providing high-yield support to compromise microvascular pathways. Second is stem cell release. The physical change in pressure activates the robust synthesis of cellular nitric oxide. This signals the bone marrow to instantly mobilize stem cells into systemic circulation, ready to target damaged areas. And the last and third one is angiogenesis. Saturated tissues upregulate vascular endothelial growth factor or VEGF, which actively stimulates the development of entirely new capillary networks over time, laying down a permanent vascular infrastructure for newly generated tissues. What does this look like in a clinical setting? True therapeutic HBOT requires a clinical monoplace chamber, like the high-pressure cylindrical acrylic system shown here. These chambers are engineered for absolute medical precision and patient isolation. The patient either sits or lies down comfortably on a sliding stretcher inside of this spacious chamber, and we gradually and smoothly increase the pressure of the pure medical grade oxygen over 10 to 15 minutes to ensure patient comfort and to prevent ear barrier trauma. As we increase the pressure, we will advise the patient to equalize the pressures in the ear. The patient then rests, reads, or even sleeps, at the targeted therapeutic pressure for about 60 to 90 minutes. And this represents the optimal window to maximize cellular gas saturation. Right. So because of these powerful cellular mechanisms, HBOT is not an alternative therapy. It is an established, FDA-approved medical intervention. We can categorize its primary clinical applications into 3 areas. First, wound healing. For diabetic foot ulcers, chronic bone infections, and radiation tissue damage post-cancer, HBOT restores localized oxygen tension, giving dormant white blood cells the energy they need to kill bacteria and force wound closure. Second is for acute emergencies. In case of decompression sickness for divers or carbon monoxide poisoning, the high pressure physically shrinks toxic gas bubbles and rapidly displaces carbon monoxide from the hemoglobin. And the third is ischemic events. This includes compromised skin grafts, sudden sensory neural hearing loss, where we must rapidly oxygenate the delicate microvascular parts of the inner ear to preserve hearing during acute blockages. Now, let us transition to the frontier that brought us all to this event, longevity and anti-aging medicine. For decades, hyperbaric was viewed strictly as a tool for wound care or for diving emergencies. However, groundbreaking clinical research over the past several years has revealed that when we utilize clinical-grade high-pressure protocols in healthy non-pathological cohorts, we can directly alter established hallmarks of cellular aging. The turning point in hyperbaric longevity research came from a landmark clinical trial conducted at Tel Aviv University and the Sagol Center, published in a peer-reviewed journal of aging. Researchers evaluated 35 healthy adults aged between 64 and older who underwent 60 daily hyperbaric oxygen therapy sessions. What makes this study so remarkable is that the participants made absolutely zero dietary, exercise, or lifestyle changes throughout the trial. Yet, the post-treatment genetic metrics revealed 2 historic results: a 38% increase in the B cell telomere length and a 37% reduction in toxic senescent T helper cells, commonly known as zombie cells. And this study provided the first concrete human evidence that we can biologically reverse cellular anti-aging mechanisms with hyperbaric oxygen therapy. To put this into perspective, let us look at the mechanics of chromosomal decay. As we see in this diagram, telomeres act as protective caps at the end of chromosomes, much like plastic tips on shoelaces. Every time our cells divide, these telomeres get shorter. When they become critically short, they trigger a DNA damage response, leading to cellular senescence or cell death. This telomere shortening is the clock of human aging. The Tel Aviv study demonstrates that high-pressure clinical HBOT can actively elongate these telomeres, reversing decades of chromosomal erosion at rates completely unachievable through diet, supplementation, or even rigorous exercise regimens alone. And when we see these cellular changes reflected directly in human tissue architecture, particularly in the skin, in a separate dermatological trial, 60 daily sessions of clinical hyperbaric sessions were shown to dramatically improve the biological structure of healthy facial skin. The massive consistent influx of pressurized oxygen directly activated dermal fibroblasts. This led to a significant increase in collagen density and a physical elongation of elastic fibers and a complete reversal of fiber fragmentation. By restoring the skin's structural matrix from the inside out, hyperbaric oxygen therapy behaves as a deep biological cosmetic therapy, making it an exceptional tool to pair with clinical aesthetic procedures to minimize downtime and to maximize collagen remodeling. The regenerative effects of hyperbaric therapy extend deep into the central nervous system. Age-related cognitive decline is closely tied to microvascular decay in the brain, which leads to areas of localized low blood flow or cerebral hypoperfusion. And neuroimaging trials, patient post-hyperbaric oxygen therapy have demonstrated dramatic increase in regional cerebral blood flow. Specifically, we see a 22% increase in blood flow to the prefrontal cortex, which governs executive function, a 19% increase in temporal lobe, which handles memory, and a 15% increase in the parietal lobe. And this physical restoration of perfusion translates directly to improved information processing speed and overall cognitive ability. At NHF Medicare, we have taken these scientific milestones and translated them into active clinical protocols. Our center utilizes the state-of-the-art medical-grade hard shell chambers capable of pressures up to 2.5 atmospheric pressure. This is a critical distinction. Standard chambers are strictly limited to about 1.3 ATA and cannot deliver pure oxygen. They are excellent for mild fatigue, but they lack the physical pressure required to trigger stem cell or elongate telomeres. At NHF Medicare, we run a dual focus protocol. Our wellness and longevity protocols, which operate between 1.5 to about 2 atmospheric pressure, focusing on mitochondrial biogenesis, stem cell release, as well as telomere preservation. And our advanced medical protocols operate between 2.0 to 2.5 atmospheric pressure, reaching the exact thermodynamic threshold required to stimulate neovascularization and resolve severe chronic wounds. The next slide I'm about to show might be a bit graphic for some viewers, so if you are not able to view, please look away. Okay, and let us look at some real-world evidence of these clinical protocols in action at NHF Medicare. On your left, you can see 2 patients with severe diabetic foot ulcers presenting with advanced gangrene and black necrotic tissue. Traditional wound care was struggling to save this limb. However, after undergoing targeted high-pressure clinical hyperbaric oxygen therapy sessions, the biological landscape changed entirely. By restoring oxygen tension, we enable the immune system to clear the necrosis and fuel the fibroblasts to build a healthy vascularized tissue matrix. And on my left, you will see, or your right, the recovery of a patient with sudden sensorineural hearing loss. This is particularly close to my heart, as if you look at as this patient was a close, dear friend of mine. Looking at the audiograms, you can see a profound hearing deficit in the initial test up above, represented by the low plots. You can see like a dip in the graph. But by introducing high pressure oxygen, we save the hypoxic cells of the delicate inner ear cochlea, leading to a dramatic documented recovery of hearing thresholds back to normal physiological limits. These are not just statistics, we have transformed lives with hyperbaric oxygen therapy. In conclusion, hyperbaric oxygen therapy is a profound, scientifically validated tool that allows us to master the physical laws of pressure and gas solubility to drive systemic regeneration. Whether your focus is aesthetic medicine, cellular longevity, or complex wound care, hyperbaric oxygen therapy serves as a foundational therapy that multiplies the efficacy of all your regenerative protocols. Thank you so much for your time and attention. I'm happy to open the floor for any questions. Thank you.
Any questions for Mr. Khuhan?
Good morning, Mr. Khuhan. I'm Dr. Wong over here.
Good morning,
Very interested in the topic. Have you ever tried the hyperbaric oxygen therapy for patients with CKD?
Yes, we have tried. So usually what we advise is we advise it to also undergo together with adjunct therapy, basically, together with their regular dialysis if patients are undergoing. So at the moment we have done, patients tend to improve in terms of with pain management, about basically better quality of life post CKD. So that is what we focus more on, right, with hyperbaric oxygen therapy.
For patients who are actually, like, for example, ischemic stroke and
Yes.
all that, right? How often do you recommend the therapy? Like every week, every once every 2 weeks?
Okay, so for patients with a stroke, usually we would recommend, if possible, daily, if not every alternate day. Okay, and we also advise patients to, actually, it's not just about how often you do the session, but also the length. You have to at least about 40 sessions for patients with stroke. So at least about 40 days or about 80 days in between this time.
So if let's say you have a good candidate, like a stroke patient, just come from hospital, went through your hyperbaric oxygen therapy, and has recovered. So the moment you cease the therapy, will there be a decline in the neurological deficit, or is it going to be as just a permanent repair?
It becomes as a permanent repair, because as I mentioned earlier, with angiogenesis we're able to provide more vascularization to parts of the brain. So this is actually a permanent fix.
So thank you very much.
Thank you very much.
Any more questions for Mr. Khuhan? I have one question from the audience. What are the investigations that needs to be done before patients start HBOT? Because the high pressure of oxygen can worsen the congestive heart failure and risk of lungs collapse.
So definitely, as what you mentioned, we will assess for those things, and we will also undergo routine, health assessment prior to undergoing this hyperbaric. And what we also do is we also provide patients with nasal spray to help to decongest the nose, because as you know, with hyperbaric, it's as if like you are going for a dive, right? You're going underwater, so we have to allow patients to equalize that part. But ultimately, patients are okay most of the times, as long as they don't have any severe heart conditions that are stable, they are able to undergo hyperbaric oxygen therapy. Not a problem at all. Very safe.
Thank you, Mr. Khuhan. Please stay on the stage. I will give the certificate of participation as the speaker.
Thank you. Thank you.
Are you not a doctor? Are you a doctor?
No, I'm an audiologist. Yeah. Okay. Thank you very much.
Thank
Okay.
you so much.
Thank you. Everything good? Yeah.